Hi everybody, my name is Dr. Reza Khoshsorour. I am an ophthalmologist with experience for 27 years in ophthalmology and ophthalmic surgery. Now we are on the Cataract Awareness Month, and it's a good opportunity to have a short video about cataract and explaining what is cataract and what are the causes and what are the treatments for cataract. Okay, let us start with the question, what is cataract? If you look at the picture, here we have the structure and anatomy of the eye. And this is the normal crystalline lens, which should be totally clear to let the light pass from all the parts to the retina. So when for any reason we have opacity in this crystalline lens, that means we have cataract. And in that situation, the light cannot fully pass through the lens to the retina, so the vision and the image will be blurry. What is the reason for that? So there are so many reasons for cataract. We can have congenital cataract, which can even appear at age 1 month. The patient is born with that. Or we can have cataract as an acquired problem. That means that the patient is born with normal crystalline lens and then gets the cataract. So there are different reasons for acquired cataract. It could happen due to trauma. It could happen due to some systemic diseases, for example, high calcium, blood calcium. High blood sugar, diabetes is one of the most important reasons of cataract. And some medicines, drugs such as steroids, if used for a long period, can lead to cataract formation. In terms of cataract, how do you find out that you have cataract? The most common main symptom of cataract is blurry of vision. This blurriness is because of the opacity in this part of the lens. But other than this blurriness, some patients come with other symptoms. As you see, this structure of the crystalline lens has different layers. So if the cataract, for example, is in this back part, it can cause sensitivity to light other than blurriness. So patients may have good vision, but unfortunately they are very sensitive to light. They can't drive in the sunlight, or they have problem in night driving. And also in some cases we see monocular diplopia, double vision. So these are not the symptoms that you can find out and say, I have cataract. There may be other reasons for them. So to find out what is the reason of blurry vision or light sensitivity, you go to your eye doctor and you check your eyes. Using machines like this one, your doctor will check different parts of internal structure of your eye and they notice the cataract. So imagine that the doctor told you that you have cataract. What should you do? Should you proceed with surgery immediately? No, it depends. In the past, it was necessary for you to have cataract to be mature, so your vision will be so low that you couldn't see anything and then go proceed with the surgery. Now, cataract surgery is an elective surgery. It's totally different. It depends on your job. It depends on your health, on the systemic diseases that you have. It depends on your needs, personal needs, professional needs. So even you can do the cataract surgery when you don't have too much cataracts. And also, if you are using glasses, especially when you are using glasses for distance and near, you can proceed with the surgery and then get rid of the glasses as much as possible, depending on your eye health. The doctor will tell you what is the best for you. So, what's the treatment? It's just surgery. Unfortunately, we don't have any drop, any pills, or any other medicine for cataract. So when you have cataract and you need surgery, you should proceed with the surgery. The surgery is easy to do. It's usually about 15 minutes, 20 minutes maximum. It's usually done under topical anesthesia. That means you use an eye drop in the eye and make it numb and do the surgery. You feel, you know everything, but you have no pain. And after the surgery, you go home within 1 hour, 2 hours. During the surgery, we put an artificial intraocular lens inside your eye. Because when we remove that crystalline lens, we have to compensate for that lens power. So we put a lens inside your eye. There are different types of lenses, so many lenses. Already, all of them are good. Depending on your situation, your need, and your consultation with your doctor, you too decide which type of lens is more appropriate for you. Okay, as we discussed earlier, there are different types of intraocular lens. Overall, the material is either hydrophobic or hydrophilic or silicone. Nowadays, with modern cataract surgeries, we can insert the intraocular lens through very small incision of maximum 2.8 and sometimes 2.2 millimeters, and we don't need any stitches for that. So it's a stitchless surgery. These intraocular lenses are inserted in a cartridge and then put in an injector, and then using that injector, we send it inside the eye, and inside the eye, that intraocular lens will be opened automatically and is put inside the capsular bag. So there are different types of lenses. Most common used lenses are lenses who are called monofocal lenses. These lenses are used just to compensate for distance vision. So after the surgery, if everything goes well, the patient can see the distance, but for reading, an intermediate patient needs glasses. That's the most common type we use. There are premium lenses. These lenses are more expensive and they are designed to compensate for other items. For example, if a patient has high astigmatism, more than 1.5 cylinder, then we have to find a solution to compensate for that astigmatism too. So we go to toric lenses. In toric lenses, the intraocular lens has a design that can compensate for patients' astigmatism too. Also, there are intraocular lenses that are designed to let the patient see distance, intermediate, and near. And also there are lenses that let the patient to see distance and intermediate, but use somehow a little bit of glasses for reading. So as you see, we have a lot of options depending on your eye situation. If you have any other problem in your eye, if you have any other systemic diseases, if there is no contraindication, you can proceed with the most advanced one and use something to see everything. Otherwise, you go for something else. So these lenses, the premium lenses, are more expensive and you have to pay some for. But for monocular lenses, usually it's covered by the insurance. These lenses are forever. So when you put it in the eye, it remains there for all your life. So you are not going to change it. This is not contact lens. This is intraocular lens. It's forever. Never comes out. Staying there forever. And if anything happens, needing any correction, depending on the situation of your eye, the doctor decides how to manage that. So I hope that this short video helped you to learn a little bit about cataract and how to treat it and the surgery and the intraocular lenses that we use. And I hope that it's useful for you. Please feel free, comfortable. If you have any problem about your eyes, feel free to come to us. We are here in International Modern Hospital to help you. So help yourself with coming to us and checking your eyes.